Ever felt like understanding Medicare is like trying to read a map without street names? Well, today let's cut through the confusion and break down Medicare in the simplest way possible. So, if you have ever wondered what it covers and how much it costs, stick around. This one is for you. Welcome to Ananta Wealth Management. Let's look into a brief overview on Medicare breakdown, and I promise I will keep it simple. So, let's look into Medicare Part A. What's the deal with Medicare Part A? Imagine you are on a road trip and suddenly your car gets flat tire. Very stressful situation, right? But what if you had roadside assistance associated with your services and it saves your day? That's what Medicare Part A is all about. It covers your hospital needs and it is like a backup plan when life throws a medical emergency at you. Let's look briefly into some of which that are covered by Medicare. All right, let's break down Medicare Part A, your trusty hospital buddy. So, what exactly is Medicare Part A? Think of it as your go to hospital support. It's the part of Medicare that helps cover those big unexpected hospital bills. In essence, it's your safety net when you need it most. Now, let's get down to the nitty gritty of what Part A actually covers. First up, and probably the most important, are hospital stays. This means if you need surgery or if you are recovering from an injury, Part A has got your back. Next is short term nursing facility care. If you need a bit of extra care after a hospital stay, Part A covers short term nursing facility care. Remember, this isn't for long term care, just a helping hand to get you back on your feet. Thirdly, home health care. Think nurse visits to your home after surgery. This is super helpful for those who need a little extra support at home. Lastly, hospice care. Um, and finally, hospice care for those with a terminal illness. This is about providing comfort and support during a difficult time for a person with a terminal illness. In terms of cost benefits, here is the sweet deal. If you have worked and paid Social Security taxes for 10 years or more, your Part A premium is usually free. That's right, free. It's like a thank you for all those years of hard work. Now, next, let's look into the costs you have to pay, otherwise called the out of pocket expenses. You know the saying, there is no such thing as a free lunch, right? Even though Part A doesn't have a monthly premium, hospital visits can still come with costs. You will have a $1,632 deductible per hospital stay as of 2025. That's the amount you pay before Medicare starts kicks in. The second one is coinsurance, meaning after 60 days in the hospital, you will have to pay $408 per day up to 90 days. And if you go beyond 90 days, you will tap into your lifetime reserve days, which will cost you $816 per day. So, what are lifetime reserve days? To help you understand with this, Medicare came up with a concept called lifetime reserve days. These are exceptionally for long hospital stays. There are 60 extra days that Medicare will help pay for over the course of your entire lifetime. So you have a total of 60 of these days to use, and once they are gone, it means they are totally gone. When you use these days, you still have to pay a daily coinsurance amount, which can be significant. Now, those numbers might seem a bit scary, But let's look at the big picture. Hospital bills without insurance, they are astronomical. Part A helps keep those costs way down. It's like having a safety net around you when you need it most. So there you have it. Medicare Part A in a nutshell: inpatient hospital care, skilled nursing care facility, home health care benefits, hospice care benefits, psychiatric hospital care benefits, and some more. Next, we will look into Part A exclusions. Alright, let's talk about the flip side of Medicare Part A, which is what it doesn't cover. Knowing the limits is just as important as knowing the benefits, right? So, Medicare Part A is great, but it's not a magic wand. It comes with limitations and it doesn't cover absolutely everything. So, what does it not cover? Okay, let's look into that right now. First off, and this is a big one, Part A does not cover all hospital or medical expenses. It is designed to help with major costs, but there will always be things it doesn't touch. Bottom line, you will likely still have some out of pocket costs. Next is private duty nurses. If you want a private nurse just for you, Part A won't cover that. That's a luxury expense, and Medicare is focused on the essentials. Next is private rooms. Unless your doctor says it's absolutely necessary for your health, Part A won't pay for it. They will cover a shared room but not the fancy private suites. Next is custodial care in a skilled nursing facility. Remember, Part A covers skilled nursing care, not custodial care. That means help with daily living activities like bathing or dressing. If you just need help with ADLs like daily living activities and not medical needs, Part A says it's not my department. Lastly, full time home health care. This is a big one. Part A helps with some home health care like nurse visits, etc., but it won't pay for a full time nursing, drugs, homemaker services, or meals delivered to your door. So, if you need 24 by 7 care at home, you will need to look at elsewhere. For example, a long term care insurance policy which covers other ADL type of services. Now you might be thinking, why all these exclusions? Well, Medicare is designed to cover essential medical care, not everything under the sun. It is about keeping costs manageable for everyone. At the end of the day, it is an insurance, not a comprehensive care plan. So there you have it, the exclusions of Medicare Part A. It is important to know these limitations so you are not caught off guard. To make long story short, it is best to always ask questions and research any plan you might be using. Next, we will go through Medicare Part B. Let's deep dive into Medicare Part B coverage. Alright, let's switch gears and talk about Medicare Part B, your go to for all those doctor visits and outpatient needs. We have covered the ins and outs of Part A earlier, your hospital buddy. Now it's time to shine a light on Part B, which handles a whole different set of medical services. Let's get right into it. Think of Part B as your outpatient pal. It's the part of Medicare that helps cover those everyday medical needs, the stuff you get outside of a hospital stay. So, what does Part B covers? First up, and this is crucial, Part B covers your doctor's fees. This means those visits to your primary care doctor, specialists, and even surgeons. Apparently, Part B is what helps pay for those professional services. Next is outpatient services. This is where Part B really shines. It covers all those services you get without being admitted to a hospital. Think clinical visits, therapy, and most treatments you get outside of inpatient care. Next is medical lab fees. Need blood work, x rays, or other lab tests? Part B has got you covered. This includes tests done in labs and clinics, not just at hospitals. In a nutshell, Part B covers your lab tests. Next one is ambulance fees. That's right, ambulance rides. If you need an ambulance to get to the hospital or another medical facility, Part B helps pay for it. Just so you know, there might be some conditions and limitations, but it is a huge help. Last but not least, few outpatient psychiatric care services. Mental well being is just as important as physical health, and Part B gets that. It helps cover therapy, counseling, and other mental health treatments outside a hospital setting. So, if you need support, Part B has got your back. Why Part B is such a big deal? Um, to answer this, Part B plays a crucial role in covering routine medical care that keeps you in good health. Without it, doctor visits and lab tests could quickly become expensive. Simply put, it's a healthcare essential. Now, you may ask a question: does Part B come included with Part A? So, to answer your question, to get both Part A and Part B, you must enroll in each of them separately, though many people enroll in both at the same time. Part A is often premium free if you have worked and paid Medicare taxes for at least 10 years. However, Part B requires a monthly premium, which in 2025 is expected to be around $174, though this can vary based on income. Now, Medicare Part B isn't free. There are some costs associated to it. Let's get right down to them. First things first, you will need to pay a monthly premium. Yes, you need to pay a monthly premium. The exact amount depends on your income, just like with other types of insurances. It's worth noting that the standard rate adjusts annually, so be sure to stay updated on those changes. Next one is annual deductible. Um, you heard it right, annual deductible. Before Part B starts paying its share, you will have an annual deductible. This is the amount you pay out of your pocket before your Part B benefits kick in. In simple terms, it's the amount you pay first before Medicare starts helping you out. It's unlike any other regular insurance, health insurance. After you meet your deductible, Part B generally picks up 80% of your covered costs, leaving you to handle the remaining 20%. In simple terms, Medicare covers most of the bill and you are responsible for the rest 20%. Lastly, 100% of some costs. Now, here is a little good news. Medicare does cover 100% of some costs like clinical diagnostic lab tests and other certain lab tests. Um, you can find a list of these tests which are eligible on the Medicare website. So, you might be wondering why these costs like premiums or deductibles. Well, it's all about keeping the Medicare program running and sustainable. At the end of the day, it's like any other insurance, there are costs associated with it. So, there you have it, the costs of Medicare Part B. It's important to understand about these costs so you can budget accordingly. Okay, let's cut to the chase and chat about what Medicare Part B doesn't touch. Because Let's be real here. Knowing the limitations is just as important as knowing the benefits, right? Earlier, we have talked about what Medicare Part B covers, but now we are going to clear up any confusion about what it doesn't cover. So, let's get straight to the point. Medicare Part B is pretty comprehensive, but it doesn't cover absolutely everything. There are some things which it doesn't cover. First up, Part B doesn't cover routine physicals or those regular eye and hearing exams. Basically, if you are just going for a checkup, you will likely have to pay out of your pocket. Next is dental care, eyeglasses, and hearing aids. This is a big one, but Part B doesn't cover your dental care or eyeglasses or hearing aids. To put it simply, if you need a new pair of glasses or dental cleaning, you are on your own. Third is immunizations. While some immunizations are covered, Part B won't cover those that are not deemed medically necessary. And any service that's not considered medically needed, well, it's a no-go. Next is chiropractor services, except for X-ray diagnosed conditions. Part B covers some chiropractic care, but only if it is for conditions diagnosed by an X-ray. Otherwise, those adjustments are coming out of your pocket. Um, Next is full-time private nursing care in the home. Remember, Part B covers some healthcare or some home healthcare, but not full-time private nursing. If you need a 24 by 7 care at home, you will have to look somewhere. Next is homemaker services by a relative or household member. If a relative or someone in your household provides homemaker services, Part B won't cover that. You have to remember this. And lastly, most prescription drugs taken at home. This is a key exclusion. That's right, this Part B doesn't cover most prescription drugs taken at home. Why? Uh, that's where Medicare Part D chimes in. Just a heads up, you will need a separate drug plan for that. Now, you might be wondering why all these exclusions. Well, Medicare is designed to cover essential medical care. Routine stuff or things like glasses and hearing aids aren't considered essential by Part B. At the end of the day, it's a matter of the definitions that the Medicare system uses. Knowing these exclusions will save you from financial surprises down the road. Well, folks, we have covered a lot of ground today. Let's recap. In a nutshell, Medicare is a federal health insurance program for people aged 65 and older, as well as for younger people with certain disabilities. It is divided into two main parts, Part A and Part B. Part A helps cover inpatient hospital stays, uh, skilled nursing facility care, hospice care, and some home health care. Part B helps cover benefits such as doctor visits, outpatient care, and preventative services. Medicare can be a lifesaver for your health and finances, but it's important to understand what it covers and what it doesn't. Make sure you know the nuts and bolts of your plan so you can make the most of your benefits. Finally, enroll on time. There are deadlines for signing up for Medicare, so don't miss out. Review your plan regularly. Medicare plans can change, so it's important to review your coverage each year. Ask questions. If you are not sure about something, don't hesitate to ask your doctor or a Medicare representative. That's all for now. Thanks for watching, and if you believe you got any value out of this video, please consider hitting the like button and subscribe for more content. I'll see you in the next video.